Assalamualaikum warahmatullahi wabarakatuh to Miss Akmal and to my fellow friends. So today I will be presenting on the critical topic of surface modification technique for enhanced nanoparticle stability and targeting efficiency in medicine. This field is at the forefront of making nanomedicine more effective and safer for patients. So we will begin by discussing one of the most established beneficial technique, PEG-lation. Let's first understand the role of PEG-lation. It is primary mechanism involves coating nanoparticle with polyethylene glycol or PEG chains. This creates a protective stealth layer that effectively evade detection by the immune system, significantly minimizing clearance from the body and enhancing the nanoparticle longevity. The pharmacokinetic benefits are substantial. So, pegylation leads to increased circulation times and reduced immunogenicity, which are crucial for improving therapeutic delivery through what we call passive targeting, allowing particles to accumulate in disease tissue like tumors through leaky vasculature, or we call it as an EPR, enhanced permeability and retention. And a landmark clinical success story is Doxil, a pegylated liposomal formulation of doxorubicin. It exemplifies this perfectly, demonstrating the reduced cardiotoxicity and improved treatment outcomes for cancer patients. Looking ahead, future research is focused on developing advanced vigilation techniques, such as using cleavable PEG or polyethylene glycol chains to further enhance the therapeutic index of these powerful drugs. Building on that, let's delve deeper into how pigylation enhances circulation time. The impact is direct and significant. Prolonged circulation allows nanoparticle more opportunities to reach the and penetrate disease tissues. The mechanism behind this is the steric barrier created by polyethylene glycol. It physically hinders interaction with the body's primary defense system, the mononuclear phagocyte system, facilitating this extended systemic presence. The clinical implication is straightforward. The longer circulation means higher concentration of the drug can be delivered to the target site, dramatically improving overall treatment efficacy. However, it's not without its challenges. A key research problem is determining the ideal length and density of the PEG change. Too little and the effect is minimal. Too much and it can hinder the drug release. This optimization is specific for each application. Pegylation is just one piece of the puzzle. This slide provides a visual summary of the clinical relevance of various surface modification technique. We can see other strategy like folate conjugated nanoparticles, which we will discuss in a moment, with a clinical example like donut. The chart breaks down the perceived benefit, showing that while pegylation offers major advantages for stability and circulation, around 20%, techniques like ligand conjugation for active targeting and charge tuning for safety and cellular uptake are also critical important for overall efficiency. The takeaway is that the combination of this method is often the most effective strategy. So, which leads us perfectly into our second main topic, ligand conjugation and targeting. If pegylation is about going undetected, ligand conjugation is about being precise. So let's take a deep dive into active targeting mechanism. First, we have the technique themselves, which involves chemically attaching targeting ligands like antibodies, peptides, or vitamins, and to the nanoparticle surface to guide it directly to specific cells. This is incredibly important in nanomedicine because it improves therapeutic outcomes by delivering more drug to the disease site while simultaneously minimizing off-target side effect. A holy grail in fields like oncology. Example of this is powerful folate conjugated nanoparticles exploit the fact that many cancer cells overexpress folate receptors. This allows the particle to be internalized efficiently by the cancer cell but while bypassing healthy one. Future directions are exciting, involving the development of smarter multi-ligand system and novel ligands that can respond to specific disease environment. The goal of the goal of all this is optimizing drug delivery. It starts with nanoparticle design, carefully engineering the size, shape, and core material to work in synergy with its surface modification. As we've di- as we have discussed, surface modification are the key to unlocking stability in the bloodstream and achieving precise targeting effectiveness. And the clinical application are already here. Ligand-directed systems are being used in clinical trials and treatments to improve outcomes in cancer therapy, gene delivery, and diagnostics, moving from theory to real-world patient benefit. To make this concrete, let's focus on prime example, folate conjugation for targeting cancer cells. Mechanism is elegant. Folate receptors are highly overexpressed on the surface of many cancer cells. By conjugating folate to a nanoparticles, we create a key that fits perfectly into this lock, facilitating selective binding and uptake. The advantages are clear. This lead to dramatically increased cellular uptake of the drug by the target cells and a significant reduction in side effect for the patient. Comparative studies consistently show that folate targeting system have improved efficacy over non-targeted traditional delivery method, proving the value of this active targeting approach. The final chart will the final chart being brings all our concept together, showing how combined strategy lead to the greatest success, while each individual technique, pigylation, ligand conjugation, and charge tuning, has a strong performance score. It is their combination that achieved the highest overall score over 21%. This underscores a central theme of modern nanomedicines. A multifaceted approach is essential for enhancing drug delivery efficiency. So conclude to conclude, surface modification through technique like pagylation and ligand conjugation is not just an add-on. It is a fundamental process that transforms nanoparticle from simple carrier to into a sophisticated targeted delivery system. These advancements are crucial for developing the next generation of effective and safe medical treatment. Thank you for your attention. Assalamualaikum.